does exercise decrease the chances of pregnancy? So the study known as the STEP and the Stress Tracking Estimate Pregnancy SSTEP trial, what did it look at? It looked at investigating the relationship between physical activity, stress, and other lifestyle changes on a frozen embryo transfer outcomes. To a certain extent, that would give us an idea whether these affected the chances of pregnancy. So, what did the researchers do in this case? They conducted a study involving 82 women undergoing hormone replacement therapy, HRT preparation, in which they replaced the embryos. Participants wore a Fitbit Charge 5 as health trackers throughout the frozen cycle of 4 to 6 weeks on an average to measure lifestyle changes. And what did they find out? In terms of physical activity, they did not seem to see any change in daily steps between pregnant and non-pregnant groups. Pregnant groups slightly increased their step post-transfer, while non-pregnant women decreased it, and this was statistically significant but not clinically related when it adjusted for age. They did not see any differences in the activity zone, heart rate, calories, and so it seems that exercise to a certain extent seemed to be safe. If we looked at stress, there was no differences in cortisol levels, awakening, 30-minute post-awakening bedtime, or average cortisol awakening response, indicating that, again, the amount of stress did not have an impact. Now, the pregnant group may have had a slightly less stressful environment, but that is, again, difficult to estimate. Regarding sexual activity, there was no difference in any of the groups, but non-pregnant group was more likely not to have sex during this procedure. But again, it gives us confidence that if you had sex during this procedure, that would not be lowering the chance of pregnancy. Let's look at sleep, and it was quite reassuring that normal physical activity, sleep patterns really do not hugely affect the chances of pregnancy. Now, what I would suggest is that while this is to a large extent for frozen embryo transfers, you could use the same data into natural conception, and where it does tell us that a certain amount of physical activity, a certain amount of stress, adequate sleep, and all those factors do not hugely change the pregnancy rates, and it's safe to exercise. It's safe to, while trying for a pregnancy, have the alterations in sleep and physical activity, and that is why it is much more reassuring as a paper.